Good evening, students. Today we are going to discuss about a lecture which is related to your body motion. Body motion mean to say the movement of your body, how your body part works during the movement of your body, motion of your body. And when someone have problem in this regard, so how occupational therapy will works. So before going deep, first we will discuss about biomechanical model. So biomechanical model is we're just going to discuss about our hands, joint of our hands, bones of our hands. This is all biomechanical model. This is our biomechanical model. So we will discuss the joints and bones of our hands. So it starts from here. This there is a bone, and that bone be called carpal. And here is the joint. This joint we called carpometacarpal joint. Carpal bone, carpometacarpal joint. Now one bone, second bone. This one we called metacarpal bone. And here we have joint. That joint we called metacarpophalangeal joint. Metacarpophalangeal joint. From there, another bone. This bone we called proximal phalanges. And next we have joint. This joint we called proximal interphalangeal joint. Next we have another bone. This bone we called intermediate phalange. Next we have one more joint. This joint we called distal interphalangeal joint. And the last one we call distal phalange. So this is all about the structure of our hand. So biomechanical model, like I said before, biomechanical model is directly linked with the motion movement of our body. So this all concept in occupational therapy we call kinetic occupational therapy. Biomechanical model we apply those patients who have problem in motions, a limited movement, musculoskeletal system issues, cardiovascular system issues, nervous system issues, all kind of limited movement of any part of body. The kinetic is the study of how force produced motion in our body parts. The next is the basic concept of motions. Motions we call movement of the joints, movement of your muscles. This all comes in the motion. Motion appears in all occupational activities. Whether you are moving, you're dancing, you're standing in a queue, etc. All that activities we need, our body need motion. So the concept of motion depend on three parts. The first part, joint range of motions, where your joint do motions. Second is strength. Strength mean to say to ability to produce tension for maintaining your body posture and move your body away. Second is endurance. Third one is endurance. Endurance is the ability to sustain motion or tension over the time to require for a particular task. So these are the three concepts which is directly linked with the motion. The first is joint range of motion. Second is strength. Strength means the ability to produce tension in your muscle, which help to maintain our body posture, control our body posture, or stabilize our body posture and move our body one place to another place. Endurance means sustainability, ability to sustain motion for any kind of task. The next we have joint range of motions. Like we all know, the joints are linked with two or more than two bones. We have connective tissues, ligaments, and muscles which linked with the joints, with attached with the joints. And ligament have flexibility, so during the motion, our joint are flexible or sometimes stretchable. You can stretch and it will come back to normal position. Like if we discuss about the intraphalangeal joints of a finger, which helps flexion, extension. Second, we have the shoulder joint and hip joint. The movement is in different direction. The one is adduction. Adduction movement mean to say when the movement is coming towards your midline of the body. There is a movement is coming towards your midline of the body. It's called adduction. Abduction, the movement is away from your body, away from your midline of your body. And the third is rotation. Rotation movement is like that. So we have three kind of movement. First is adduction, which is coming towards your midline of your body like this. This one is the midline of your body. Second is abduction, which is going away from your midline of your body. Third is rotation. So next we have two type of motion. The one is active motion and second is passive motion. Active motion is done by human beings with the help of the volunteer muscle. These are all volunteer muscles. And the passive motion is when your volunteer muscle is not working and someone is giving force outside for the movement of your voluntary muscles. That force we call passive force and passive movement of your muscle or of the joints. So this is how we differentiate active movement of the joint and passive movement of the joint. Active, which is directly linked with the human being, which we are doing by our own self, and passive, we are having outside force for the contraction, bending. We have two type of endurance. The one is muscular endurance and second is cardiorespiratory endurance. Muscular endurance directly linked with your muscles, single muscles, the movement of single muscles, and the sustainability happens on single muscles. We call muscle endurance. But the second we have cardio cardiorespiratory endurance is the ability of your heart, blood vessels and lungs to deliver oxygen to your working muscles. Cardiorespiratory endurance increase the capability of your lungs, your heart, your blood pressure and your muscles to perform work over an extensive period of time. Now, student, we will discuss about the therapeutic intervention. So, when we have any the problem in a movement, in a motion, then the therapeutic intervention will take place. It works on three concepts. First, it prevents deformities and maintaining existing capacity for motion. The first one is this. Second one, restoring the capacity for motion. This is the second one. Third one, compensating for limited range of motion, strength, and endurance with the compensative techniques. For example, we use splint so that joint will hold properly and it will have less damage later. So student, this is all about a lecture today. So I'm just squeezing out the important things in the lecture, and I'm explain all that important definitions, important movement, like biomechanical model. It's very important. Your biomechanical model is very important. So far so good. Thank you so much, students. I'll see you in next lecture. Till then, take care.